In a randomized placebo-controlled trial, protein supplementation took spinal fusion success from 60% up to 83%. Infection dropped from 15% down to 0. This is compelling data, and if you're having a spine surgery or know somebody who's having a spine surgery, you should really take a look at this information. So let's dive into what this data shows. I'm Dr. Patrick Denard. I'm an orthopedic surgeon with over 15 years experience and founder of the Thrive Protocol. In addition to my practice, my mission is to help people get back to their life after surgery by controlling the simplest thing you can do in your outcome, which is leaning into nutrition. So I'm going to share with you some information that's important to spine surgery in this particular video. Now, we all know that spine surgery, in particular spinal fusion, has a bad rap. It's associated with a really long recovery and a high complication rate. Nobody wants to undergo this procedure unless they absolutely have to. Now, if you look at spine surgery or fusion in particular, this is a demanding procedure. You're asking areas that have previously not been fused together in many cases to be fused. And in order for your body to accomplish that, you have increased metabolic requirements. That leads to the need for having more fuel in your body going in. So what does the data actually show in this? I mentioned this trial earlier. A study in 2022 was a randomized controlled trial, double-blind, placebo-controlled, meaning they had two groups. One group took protein supplementation, the other group just had a regular diet, and it was placebo-controlled. Fusion rate at 6 months, 83% fusion rate in the supplement group compared to 60% in the placebo group. Now that's a huge number. If you look at that difference, that's as large as any sort of surgical technique factor you're going to find. And what's really interesting is it's something that's so simple. Just simply doing protein supplementation and having the building blocks for your body to recover allow fusion rates to go up dramatically. But that's not the only thing. Infection rate dropped from 15% in the placebo group to 0% in the supplementation group. Now, if you get a spine infection, that can be a devastating problem. It can really be a troubling thing that requires multiple repeat surgeries. And if you look at something like that, that's a 15% down to a 0% rate, the answer is quite simple. Protein supplementation is a no-brainer. In addition to infection, wound healing rate was higher in those who had supplementation. So healing at 15 days was 100% in the supplement group compared to only 5% in the placebo group. That's a 20-fold difference. All of us want to get back to our life as soon as possible, and that is important to have wound healing. Of course, you can help do that. And it really reflects what's happening inside the body as well. Now, it's not just protein. Other information has shown that nutrition is really important for spine surgery outcomes. For instance, patients low in vitamin D have been shown to have a lower fusion rate and more pain after surgery. If you look at the overall rate of vitamin D deficiency in the United States, it's about 1 in 3. So you have the option of either getting a vitamin D level prior to surgery. You can ask your surgeon to do that. You can also just supplement with vitamin D. Personally, I would recommend both, but certainly supplementing can help you get through your recovery. It's also been shown that a combination of amino acids and vitamin D lead to less strength loss after spine surgery. Now, this is relevant because what you're doing here is you're restoring or preserving the muscle that helps you get up and move around and get a quick recovery. And the key is really having leucine. Leucine is the most important amino acid in muscle synthesis. Typically, you want a dose of around 3 grams. That's more than you're going to find in an off-the-shelf protein in most cases. And that's why in OptiFuel, we put in 3 grams of leucine because that goes along with the clinical studies which show that 3 grams can offset or prevent muscle atrophy after surgery or immobilization. So what should you avoid? It's the standard things. You want to avoid processed food, high sodium foods. But the big point here is that you can't just simply rely on eating well alone. Really, if you're going to have the fuel for your body to recover, you need to supplement in addition to eating a healthy, well-balanced diet. I would recommend that you supplement once a day at minimum, and even twice a day if you're really trying to control your recovery to get through this quickly. The concept at Thrive Protocol is to prepare in advance. We recommend that people start a week prior to surgery. They start loading with protein. then the night before do carbohydrate loading so they have the immediate energy in their body to get through that surgical stressful event, and then recover afterwards by continuing protein supplementation daily. So a higher fusion rate, a lower infection rate, and a faster chance of healing your wound. All of this makes the decision simple. If you're having spine surgery, supplement on a daily basis, increase your protein, and consider the addition of vitamins such as vitamin C and vitamin D, and good luck.